So we're now open for discussion. Does anyone have questions or comments? Yes, please.
So I think we had questions about that in the survey, but that our duration of breastfeeding data was somewhat hard to interpret. And so I'm going to look into it and we'll get you a follow-up answer on that.
Because I think those are some of the things that could help drive policy. I know when you talk with these families, those are some of, and it's not always just return to work. But that they can't now devote sort of being at home as a new mom kind of activities.
Hi, Rachel Johnson. This is a question for Virginia. So, hypothetically, if juice was not available in the WIC package, do you have any concerns about parents seeking out other sugary beverages? And then, you know, with the marketing strategies, in fact, there was just a paper released yesterday from the Rudd Center that said there's so much confusion about what is healthy, you know, whether it's sports drinks or vitamin waters or energy drinks. So would it concern you that they would then seek out other alternatives to juice?
My thought would be they're doing all of that already, okay? You can look at any food record done on those. So if the families are already doing that, and they don't necessarily understand the difference between 100% juice, the fruit drinks, and I think not unlike what we tried to do in the school meal settings, that our message could be as simple as breast milk or formula and water. And that's really where we need to be. And then it makes it easier to, if you are going to use juice, it's a treat or a special thing. Hopefully the soda is not a special thing in the youngest kids, but we know it is part of our culture. Nutritionally, I have no concerns. And in fact, we've done better at getting, the dietary data we heard earlier, the vitamin C intake is not a problem. And that's, if you go back, if all of us who are old enough, the reason, you know, the vitamin C DRI used to be, or RDA used to be higher, this whole concern about vitamin C. I don't think it's a public health concern. And I think we're doing such a much better job with fruits and vegetables. So, and we shouldn't pretend that it's not there. And I think the teaching message would be clearer.
This is a question for Park and Raphael. You both mentioned little or low cost incentives for breastfeeding women, and I'm having trouble imagining what those might be that would be sufficient to have women who are on the fence about breastfeeding either take it up or keep going, given that what puts them on the fence is pretty dramatic.
Can I leave that to you?
Yeah, so I mean, based on the Loving Support IOM workshop, the things that were listed were like slings to carry the baby, like clothing for the baby, diapers. Diapers are apparently an important incentive as well. So, and the concept is not so much because of the economic value, but it's because of the recognition and pushing in terms of behavior change theory a stepwise process. Not every time you take a small step, you will be recognized. But it also has to do with how this is presented. You know, is this just an interaction in an office, or is this going to be a group type of recognition? And, you know, these are teachable moments that if the incentives, not only that what is the incentive, but how it is presented. And the same goes to the week food packages.
So just to comment on that, I don't think there's a lot more role for incentive at initiation. Again, I want to think about what's going on in those very short, healthy baby prenatal, postnatal hospitalizations that are now 36 to 48 hours, 72 hours sometime. So I don't think that's there. But I do believe incentives afterwards, and again, in a research setting, we have used, not that WIC can do it easily, but we really have used diapers as the other thing that has both economic power and feels like a real recognition. You know, in the study, you provide the formula, which is worth hundreds of dollars a month. The other expensive thing about having a baby is the diapers. So those are very real, effective things.
And I totally agree also with what you said. I mean, the sentiment of the Loving Support Workshop Committee was that, you know, this is not of enough economic value to make the difference in an extreme way, but it's also about marketing the program. And wouldn't you love to see all these babies saying, you know, I'm a weak 3-month-old breastfed baby, or, you know, it becomes also a vehicle for enhancing the image of the program in terms of breastfeeding promotion and support.
Any other questions or comments? Then I'd like to thank our presenters very much. It was a wonderful session.